Doctor, tell us about the importance of the screenings. I feel like we can't emphasize this enough.
Well, we have known for many years, more than 4 decades, that we can identify patients at risk.
Right.
And those are the patients that would benefit from a program like a CT screening program. And smoking, as we talked about in the earlier segment, is a primary risk factor. It's easy to identify someone who has been a smoker. The trouble we have is identifying patients with other risk factors, and
right.
we mentioned a couple of those. Asbestos is an occupational exposure. Many people that were working with asbestos may not even know that they have been exposed to it. Radon is a nuclear particle that's in the soil, and someone's house or may have been built over a radon prevalent area, and they may have been exposed as a young boy or a child and may not even know it. Right. So those are the patients that are difficult to identify. Family members who've prior had cancer, people who are non-smokers, we know 15 to 17% of patients who are diagnosed with lung cancer are non-smokers. So what caused their cancer? So we do think that there's a genetic link to it, and it's very difficult to identify those patients who are at risk.
When you can identify those patients that are at risk, are they usually going to see their primary care physician to get these screenings, or does a primary care physician say, hey, I'm going to send you so that you can get additional testing done?
So nowadays we've had a number of studies that have demonstrated there's a benefit to lung screening, and most primary care physicians realize that screening their high-risk patient populations, those smokers, is beneficial. So most primary care or pulmonary medicine or internal medicine doctors are now identifying those patients at risk and referring them, or at least having a conversation with the patient about getting a CT scan for screening purposes.